Hi, I'm Sophia Sarris of Wonder Love Lactation, and today I want to talk to you about crying. Most babies cry for one reason or another, and usually after a few weeks we've kind of learned which cries mean what. But there's a certain kind of crying that we've coined the term of purple crying for, and that's chronic, incessant crying, and you can't really find a reason for. We know that purple crying happens in most babies to some degree across all cultures, no matter how a baby's fed. Most theories suggest that periods of crying or colic are a normal part of your baby's brain development. In other words, they have very little to do with how your baby's fed, with your breast milk if you're breastfeeding, or anything that you ate recently. Good news is that it doesn't last forever. It usually peaks around 2 months, and it commonly subsides between 3 and 5 months in most babies. The P in purple is for the peak of crying. It may increase in the first few weeks and peak around 2 months. U is for unexpected. It comes and goes, and you don't know why your baby's crying. R is for resist soothing. It's very difficult to soothe these babies. Sometimes what works one day doesn't work the next day, or it can change from minute to minute. P is for a pain-like face. It appears that your baby's in pain and you don't really have a reason why. It doesn't seem like anything should be bothering them. And L is for long-lasting. Often it can last for hours in some babies, and if you're lucky, just a few minutes. E is also for evening, and that's the last letter, and it generally happens in the late afternoon or evenings for most babies. As difficult as it is, you need to respond to your baby's cries. It's important not to leave your baby to cry alone. If you need to put him down for a brief period and walk away, that's okay. Take 5 deep breaths. You can put on earphones. Your baby won't know you're wearing earphones. As long as you can sing to your baby or calm them, that's okay too. Sometimes just breathing slowly and deeply while you hold your baby or swaddle them close will also help them calm as well. No one should be sad and alone, especially babies, so try to comfort your baby through this hard period of time. Strategies to calm your baby include swaddling. Sometimes just wrapping your baby very snugly and holding them close will help calm them. I say it helps them gather their thoughts. Swaying very rhythmically and smoothly will also help. Try not to bounce or use movements that are jarring to your baby, because that may make it a little worse. Music can be very calming, and gently touching but with firm, gentle touch will also help. Massaging your baby's stomach or back will help. Sometimes rubbing their extremities, their arms and their legs firmly and smoothly and kind of stroking down and away will help calm your baby. Also, pressure on the palms of the hand and the soles of the feet is very calming for babies. If the weather's reasonable, go outside. A lot of times you might start a walk with a screaming baby, and by the time you get home, they're much calmer or asleep. You can use your stroller or you can wear your baby, whatever you prefer. Fresh air and sunlight's good for everyone. If your baby likes to ride in the car, take a car ride. Goals for purple crying include stay as calm as you can. Be consistent. Try not to get too anxious or nervous with your baby, because your baby reads your cues. Demonstrate calm, and eventually your baby will also be calm. Know that this period will pass. Try something new if the regular things aren't working. If music isn't working, try massage. If massage isn't working, try music, and vice versa. And don't think that because it didn't work the day before, it won't work today. You never know what's going to work that day. Try to do something for you once your baby's calm. Mom and dads need rewards too. When to worry. If your baby's very young and is crying in a very high-pitched screaming cry that you cannot console, you need to call your pediatrician. Other reasons to worry are babies that cry with accompanying fever, vomiting, or diarrhea. Those are reasons to call your pediatrician right away. Please remember that this part of parenthood will pass and you'll move on to something different, and it'll all end up just fine. Take care of yourself and take care of your baby, and if you need help, ask your pediatrician for help or consult someone who can help you. Thank you.